The Australian health system is in crisis. The decades-long war of attrition waged against public health by Labor and Liberal national governments alike had created a catastrophe even before COVID-19 was allowed to spread across the country. With the reckless and dangerous reopening of Victoria and New South Wales, this crisis has only gotten worse. There is widespread understaffing. The lack of newly trained reserve staff has meant that health workers are forced to work longer hours and more shifts. In December 2020, an audit of nurses in New South Wales revealed that 90% worked unpaid overtime above their allocated hours. Of this group, nearly one-third reported working overtime every day. The Australian Medical Association Annual Health Check report revealed that 50% of training doctors in Victoria said they had made a mistake due to excessive workload and understaffing. 47% said they were not paid for working unrostered overtime. These numbers were all before the recent wave of the Delta variant swept through the two states. Hospital wait times have skyrocketed, with fewer beds available for patients. The number of beds available for people aged 65 and over has dropped to a record low of 15.8 from around 33 beds in 1991. The promises by both Labor and Liberal governments that they would increase the number of staffed ICU beds is an outright lie. In truth, since March 2020, some 200 staffed ICU beds have been lost across the country, an 8% reduction. Ramping of ambulances is now commonplace, and increased wait times are reported in every state and territory. In Victoria, where COVID-19 case numbers are highest, hospitals rely on students, SES crews, and volunteer first responders to help drive ambulances. On November 7, the CEO of Ambulance Victoria came close to calling a code red, meaning there were no ambulances available for call-outs. They expect a code red will happen soon. Health workers are rightly angry. They have witnessed decades of gutted health budgets that they are expected to compensate for with their intolerable workloads and hours. To silence this opposition, the Australian government has passed electoral laws that prevent people from voting against Liberal and Labor. This is aimed particularly against left-wing opposition, specifically the SEP, the only party fighting for the elimination of COVID-19. For a healthcare system based on human life, not profit, join the SEP today.